Candidiasis is a fungal infection caused by the causative agent Candida albicans. Candida species can grow into two different forms, yeast or filamentous. Yeast are single-cell, oval-shaped, and then they reproduce by budding. Filamentous forms are made of long, connected cells. There are two types of filamentous forms, which are pseudohyphae and hyphae. Pseudohyphae are like chains of oval-shaped cells with noticeable pinched areas where the cells connect, and they are very, very branched. Hyphae are straight. They have parallel walls with clear separations between cells, and they do not have the pinched connections that are seen in the pseudohyphae, and they don't branch as much.
Let's break down the main player behind most cases of cystitis, E. coli. E. coli is a gram-negative, rod-shaped bacterium. It's usually arranged in single rods, not clusters, not chains, just individual little rods doing their own thing. What makes E. coli especially good at causing bladder infections? It has fimbriae, tiny hair-like structures that help it stick to the lining of the bladder. Without those fimbriae, the bacteria would simply get flushed out of the urine. Structurally, E. coli has a thin peptidoglycan layer and a tough outer membrane made up of lipopolysaccharides, which makes it harder for the immune system and antibiotics to attack it. Some strains have flagella, giving them motility, basically allowing them to swim up the urinary tract to reach the bladder. And yes, many E. coli strands that cause infection also have capsules, a protective outer coating that helps them avoid being killed by the immune cells. Important note, E. coli does not form endospores. Endospores are survival tricks some bacteria use under harsh conditions, but E. coli doesn't rely on that. It survives just fine with its other defense mechanism.
Some important signs and symptoms of candidiasis that you might want to go see a healthcare provider about are skin redness or rash, itching, blisters, lumpy white patches, pain, soreness or discomfort, burning sensation, and abnormal vaginal discharge. All of these symptoms are indications that you may have a vaginal yeast infection. If candidiasis is left untreated, severe infections could spread to other parts of your body, including your blood, your heart, your brain, your spinal cord, your eyes, your kidneys, your urinary tract, your liver, or your spleen. The infection from the Candida albicans can spread throughout your bloodstream and cause other potential problems throughout your body. Some hospitalized patients, normally those who are very sick, can get invasive candidiasis. This is an infection that's way worse. It is an infection in their bloodstream, joints, or organs. And this is the most common type of invasive infections. Untreated infections carry the risk of leading to systemic infection, like the other organs mentioned before, and the patient can eventually become septic. This particular species, candidiasis, is an endogenous infection. And what does that mean? Endo is a prefix that means inside or within. An endogenous infection starts when a microorganism is already present in the body, like part of the normal flora, and it causes infection. Yeast infections are not contagious. Yeast infections is the cause of the overgrowth of normal flora that is present in your body. People who have weakened immune systems or specific medications make you more at risk for getting an infection because those things weaken your body and you can be more susceptible to an overgrowth of bacteria in your body. It is very unlikely that a healthy person will pass a Candida albicans infection to someone else. Candida infections are treated with antifungal medication like Nicotinamide, clotrimazole, amphotericin B, and metronidazole. Mild to moderate general candida infections can be treated with antifungal vaginal creams, which are available in 1-day, 3-day, or 7-day treatment options. In some cases, a single oral dose of iconazole or fluconazole, 150 milligrams, may be prescribed. Both oral and topical treatments work equally well, but oral medications tend to be more expensive. However, fluconazole should not be prescribed during the first trimester of pregnancy. That is a contraindication. For recurrent vaginal candida infections like fluconazole, it typically is given on days 1, 4, and 7, followed by weekly doses for 6 months. Similar treatment plans are used for oral thrush, with oral lozenges as an alternative dosage form. Systemic candidiasis, it is a more severe infection and requires treatment with oral or intravenous antifungal medications like casulfungin, fluconazole, or amphotericin B. Some preventative measures that you can take to avoid a yeast infection is to maintain a good personal hygiene. Maintaining a good personal hygiene, along with changing out of wet clothes promptly, both go hand in hand to not let bacteria harbor and be more susceptible to getting into your vagina area. Following a well balanced diet is also important because some foods naturally have a high acid content, and it is important to maintain the pH balance. Managing stress and keeping blood sugar levels under control is important if you have diabetes. It's very important to avoid douching or using scented feminine products. Douching is when you use something other than water to clean the perineal area or the rectum area. Deodorants are something that you should avoid also because it can cause further infection. Candidiasis is a very common condition. The most frequent type of candidiasis is a vaginal yeast infection, which affects about 75% of women at least once in their lifetime. Although this is rare, serious cases of invasive candidiasis affected nearly 25,000 individuals in the U.S. every year. There was no mention on any website I can find about prevalence of candidiasis albicans in the urogenital system, but I did see a mention about oral candidiasis. It is also caused by the same causative agent, but it is in your mouth instead of your vagina. In the 1980s, there was a clear surge of interest in oral candida infections because of the escalation in AIDS. The reason candidiasis albicans was so prevalent in that time and now is because it is naturally occurring in your body. It is an endogenous infection. When you have a weakened body system or an environment that harbors the overgrowth of this infection, it can cause an imbalance of this infection in your body system. It's most prevalent in South America, and it seemed to fall between 0.74 and 0.6.0 per 1,000 hospital admissions. Even with the advancements in diagnosing and treating fungal infections, challenges in infection control and difficulties in assessing proper treatment are mainly because of costs and delays. It contributes to a high mortality rate, 30% to 78% of people. And this is because in South America, they are classified as a low to middle income nation. An outbreak of systemic candidiasis albicans occurred in London in 1985. Over 9 months in an intensive care unit, there were 13 patients that developed definite symptoms and signs, and 1 patient with probable systemic candidiasis. 25 more were also possibly infected. No environmental source could be identified at this time. The infection spread via cross-contamination with evidence of transmission from nurses' hands, as the strain was found on 4 nurses and survived well despite hand washing with hippie scrub. The treatment involved antifungal medications like amphotericin B and flucytosine. but mortality rate was high, with only 2 patients surviving. The study emphasized the need for better infection control measures, including improved hand hygiene with more effective antifungal disinfectants. An interesting fact about the lecture today is candidemia is a serious kind of yeast infection that gets into the bloodstream. It's very common in hospitals, especially when someone has surgery or uses medical devices like catheters or breathing tubes that give the fungus a way into the body.
Signs and symptoms of cystitis. One of the hallmark signs is dysuria. That's the burning or painful sensation when you urinate. Many people also notice they're running to the bathroom much more often and feeling a sudden urgent need to go, even when their bladder isn't full. Another common symptom is nocturia, meaning when you wake up multiple times during the night needing to urinate. Definitely something that disrupts your sleep. In some cases, you might see hematuria, or blood in the urine. This can make urine look pink, red, or cloudy, and is always a sign to seek medical attention. Beyond that, people often experience discomfort or pressure in the lower abdomen or pelvis. It can feel like heaviness, cramping, or just achy pressure that is hard to ignore. In more severe cases, the urine might start to smell foul. That's because bacteria and white blood cells build up in the urinary tract, causing the odor. And if infection starts to spread, the symptoms can get even more serious. You might develop fever, chills, and generally feeling of being unwell, also called malaise. These are warning signs that the infection could be moving beyond the bladder and immediate medical care is needed. The bottom line, recognizing these symptoms early and acting quickly can prevent the simple bladder infection from turning into something much more serious. Progression of cystitis if left untreated. If cystitis isn't treated, the infection can spread to the kidneys, causing a condition called pyelonephritis. This triggers symptoms like fever, nausea, vomiting, and a sharp pain in your side or lower back. Even more serious, if the infection gets to your bloodstream, it can cause sepsis, a dangerous and potentially life-threatening condition. Repeated or long-term bladder infection can also damage the bladder itself, making it harder to store or empty urine properly. And for pregnant individuals, untreated cystitis can increase the risk of preterm labor or having a baby with a low birth weight. Serious consequences that make early treatment essential. Now, how does cystitis usually happen? It typically starts when bacteria from the gastrointestinal tract enters the urinary tract. Risk factors include poor hygiene, sexual activity, use of urinary catheters, and not fully emptying the bladder. Women are especially susceptible because their urethras are shorter, giving bacteria a faster route to the bladder. For treatment, antibiotics are the frontline defense. Common options include the ones listed on the slide. The choice depends on how severe the infection is and whether the bacteria are resistant to certain medications. In addition to antibiotics, drinking plenty of water and urinating frequently can help flush bacteria from the urinary system. Prevention is just as important. Key strategies include maintaining good hygiene, staying well hydrated, urinating after sexual activity, and avoiding irritants like harsh soaps and douches. For individuals with frequent infections, healthcare providers may recommend low-dose antibiotics for prevention or suggesting cranberry supplements. Speaking of cranberries, how do they help? Cranberries contain natural components called prothrocidins, which can help prevent bacteria, especially E. coli, from sticking to the walls of the urinary tract. When bacteria can't stick, they're less likely to cause infection. It's important to remember that cranberries are better for preventing infections, not treating the active one. And what about vaccines? Currently, there are no approved vaccines for urinary tract infections, but research is ongoing. Scientists are developing vaccines aimed to helping people who experience recurring UTIs. Progress is promising, but for now, prevention and early treatment remain the best defense. Bottom line, early recognition, prompt treatment, and smart prevention strategies can make all the difference when it comes to cystitis. Historical and current prevalence or incidence of cystitis. Let's talk about cystitis, a surprisingly common but sometimes misunderstood condition. First, cystitis, a type of urinary tract infection, has shown an interesting global trend. In 1990, there were about 200 million cases worldwide. Fast forward to 2019, and that number climbed to about 250 million. But here's the catch. Even though those cases increased, the rise was moderate. Thanks to better hygiene, healthcare, and prevention, we've been able to control more serious outcomes. In high-income countries, though, there's been a slight bump in reported cases, not necessarily because the infection is more common, but because better diagnostic practices and aging population has increased, meaning we're catching the cases earlier and preventing them quicker. And that's good news. Treatment outcomes are better than ever. Let's talk about cystitis, a surprisingly common but sometimes misunderstood condition. First, cystitis, a type of urinary tract infection, has shown an interesting global trend. In 1990, there were about 200 million cases worldwide. Fast forward to 2019, and that number climbed to about 250 million. But here's the catch. Even though those cases increased, the rise was moderate. Thanks to better hygiene, healthcare, and prevention, we've been able to control more serious outcomes. In high-income countries, though, there's been a slight bump in reported cases, not necessarily because the infection is more common, but because better diagnostic practices and aging population has increased, meaning we're catching the cases earlier and preventing them quicker. And that's good news. Treatment outcomes are better than ever. Now let's dive into a real-life example. A case study from Candida Journal, Infectious Diseases and Medical Microbiology tells the story of a 68-year-old woman who struggles with recurrent cystitis for 6 months. Even after multiple 14-day courses of levothyroxine, her symptoms kept bouncing back. Her history of well-controlled diabetes mellitus didn't help either. Every time her urine cultures grew, E. coli bacteria that should have responded to the treatment kept growing. But deeper investigation found that the real problem was she had post-void residual volume of 150 milliliters, meaning she wasn't emptying her bladder completely. That stagnant urine made it easy for infections to return. Once she was taught to practice double voiding and switched to 6-week courses of nitrofurantoin, her symptoms resolved, and 6 months later, she stayed infection-free. And here's a fun and important fact. Not all cystitis is caused by bacteria. Some cases are due to interstitial cystitis, or IC. Unlike bacterial cystitis, IC does not respond to antibiotics because there's no infection involved. Instead, it's believed to stem from bladder lining damage, nerve dysfunction, or even autoimmune responses. Studies have shown that people with IC often have high levels of mast cells and inflammatory markers in their bladder, pointing to their immune system playing a role in their irritation. So whether it's a classic bacterial infection or a more complex immune condition like IC, cystitis is a lot more than just a bladder infection, and understanding the cause is key to getting the right treatment.
Questions about candidiasis. Questions about cystitis. Thank you for watching, and are there any questions?